Hi guys, how is everyone? So we are in the festive season currently and we have celebrated Diwali a few days back. During Diwali every year I get this thought that the burn patients increase a lot. A lot of people burn their hands with crackers, they burn their hands from diyas or candles. So it's important that we discuss how to give first aid in burns. Usually the management of burns depends upon the degree of burn and the percentage of burn, like whether the burn is first degree, second degree or third degree, how deep it is, and it also depends upon the percentage of burn, that is how much surface area of the body has been burnt. So in this video I'll tell you about the first aid in minor household burns which you get in day-to-day life and more so during Diwali. So let's begin. Suppose you get a burn on your hand, for example, which is the most common site. What you need to do is keep your hand under running water. The water should not be very cold, it should be slightly cold. It should not be ice cold. Be careful about that. It should not be ice cold, and never apply ice on your burn wound. Ice causes vasoconstriction, the blood supply to your skin decreases and the injury increases. So never apply ice on your burn wound. Keep the burnt part in cold water for at least 10 to 15 minutes. See, this is the minimum time. What we do usually is we keep it for 2 minutes or 3 minutes and then we feel like it's fine, let's get on to work. But that is not going to help in any way. You need to keep your hand in cold water for at least 15 minutes. And by the time you cool your hand, ask someone in your family to get a burn antibiotic cream for you. Some antibiotic creams are available, some silver based creams are available. You need to apply any antibiotic cream on your burn wound and then cover it with a sterile dressing. This dressing you can also easily get in the market. So these are the 3 basic steps of first aid in minor burns. Keep it in cold water and the water should not be very cold. Apply the antibiotic cream and cover it with sterile dressing. Once you do all these things, you will feel relieved and you can get back to work. Sometimes you may feel some itching and pain. For that you can take a painkiller. And after a day or two, make sure you visit a doctor once, because you are not aware of the depth of the wound. You might feel relieved, but the injury could be deep enough to cause a later complication. So you need to visit a doctor. He will analyze the severity of the injury and then he'll advise you further. What happens sometimes is that a contracture develops, especially in hands. You ignore the burn injury and then you develop a contracture, and because of the contracture the movements of your hand get restricted and that can lead to disability later on. So you need to be very careful about burn wounds. I have seen people in India, they apply toothpaste on their burn wounds. See, the logic behind that is it gives a cooling and calming effect. Might give you that effect for that time being, but the problem is it has sodium fluoride in it, and sodium fluoride creates a layer over the wound which prevents the heat from dissipating outside. The heat gets captured inside the wound and it will lead to more damage. So never apply toothpaste on your wounds. Some people apply neem leaves on their wounds. See, neem might have medicinal properties, but the problem is you're getting the leaves from outside. It will get all the dust and all the microorganisms along with it, and you're going to infect your wound. Do not apply anything which is dirty. There are some herbal medications which are scientifically proven to be advantageous, like honey is advantageous. It has antibacterial action. Aloe vera is advantageous. Papaya extracts are advantageous. It has been written in our books as well. There are a lot of studies which say that these herbal products are useful in burn wounds. But you don't need to try fancy things. All you need to do is follow the first 3 steps. That's all. After following the 3 steps, you need to get a tetanus shot, which is recommended in burn wounds. So if you have not got your booster dose in the last 5 years, make sure you get a tetanus shot. You need to be careful about few burns, like hand burns, face burns, and burns in the genital area. These are considered serious burns and usually require observation and admission. So make sure if you have burns in these areas, you visit a doctor for sure. Talking about electric burns, sometimes you get a shock in your household socket. That is not much of a problem. The problem is if you get an electric shock or a burn from the high voltage wires outside your house. You need to take those very seriously. These can lead to cardiac changes and some serious cardiac problems. So make sure you visit the emergency definitely if you get a shock or a burn from the high voltage electric wires. So that is all for this video. I will be starting my plastic surgery residency very soon, and during that time I will be treating a lot of burn patients. So I'll share my experience with you, and that is all for this video. Take care, stay safe, stay healthy. Namaskar.